Hello, and welcome to the informational video webinar series on the rules for certified childcare centers. This is video number 19, covering swimming, animals, and night care. My name is Christina Austin. I work for the Childcare Licensing Division as a regional manager in the Tualatin Field Unit. The Childcare Licensing Division hopes that you find these videos informative and supportive in learning about the new Certified Childcare Center rule set. During each video in the series, we will explain some of the key features and highlights of the Certified Center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Childcare Center Rulebook for the full list of requirements and rules. Now let's get started. Let's start with swimming. A certified child care center must not use a swimming pool unless it has been licensed by the Oregon Health Authority or delegated agent. Swimming pools must be maintained, cleaned, and sanitized according to the local health jurisdiction guidelines. The program must ensure that a certified lifeguard is present and on duty at all times. Center staff lifeguards may not count in staff-to-child ratios when more than 10 children are present. A certified child care center must have written permission from each child's parent or guardian before engaging in any swimming activities. The center must review safety rules with children each time they participate. A center must not permit children to use or have access to a hot tub, spa, portable wading pool, or other similar equipment. Please note, there are other rules regarding swimming and pools. Read the Certified Child Care Center rules closely if your program offers swimming activities or has a pool at the facility. In natural bodies of water, such as shallow surf, lakes, rivers, and streams, the center must limit activity to wading by children 36 months of age and older and must not allow swimming. Next, we will review requirements for animals. A certified child care center must ensure that any animal at the center is in good health and shows no signs of carrying disease, friendly toward children with no signs or history of aggression, kept free of fleas, ticks, and worms, fully immunized including rabies vaccinations for dogs, kept in a cage or tank with the exception of cats and dogs, and not permitted in food preparation areas or on children's resting surfaces. A certified child care center must inform parents of any animals on the premises through a clearly viewed notice or bulletin, policy handbook, parent flyer, or a statement included on the enrollment form. A certified child care center may not allow an animal with any history of biting to be on the premises of the center. The center must also prevent any direct contact by children with any animals unfamiliar to the center, such as a stray. When interacting with animals, a certified child care center must ensure that all contact between an animal and a child is supervised by staff who are close enough to remove the child immediately if the animal shows signs of aggression or distress, or if the child shows signs of treating the animal inappropriately. A certified child care center must have and follow written procedures for the care and maintenance of any animals in the center. The procedures must address responsibility for the handling, care, and feeding of the animal or animals. With close staff supervision, children may participate in the care of animals. At least weekly cleaning and disinfection of pet containers and cages performed in areas not used for food storage or preparation and only when children are not present. Location of litter boxes in areas not accessible to children or used for food storage or preparation, and prevention of debris spilling out of a container or cage used for pets and animals if applicable. A certified child care center must keep animal food supplies out of the reach of children and store them separately from food supplies and equipment. Animal food must be stored in a manner that does not attract rodents or insects. Please note, there are other rules regarding animals. Please be sure to read the Certified Child Care Center rules closely if your program has any animals at the facility. Next, we will review night care requirements. A certified child care center must meet the staff-to-child ratio during night hours. In addition, there must be at least 2 staff present and awake at all times. All sleeping and awake children must be within sight and sound of staff at all times. A certified child care center must not allow anyone on site other than center staff, parents, and individuals authorized to pick up children in care, and a certified child care center must provide staff training on evacuating sleeping children in an emergency. A certified child care center must maintain an activity plan for children according to their ages, interests, and abilities and provide quiet time activities such as story time, games, arts and crafts, homework and reading for each child arriving before bedtime. Toys and equipment available to meet the needs of children in night care, an activity area away from sleeping children where the awake children may engage in activities, and an opportunity for children to sleep at various times based on their age and need for rest. A certified child care center must ensure all sleeping rooms used by children have 2 usable exits approved by the fire code official. All exits are visible using lighted exit signs or by lighted exits such as a hall light or lamp which lights the exit path and door, and each room is equipped with a battery-powered light source. If providing night care, a certified child care center must provide the following accommodations for sleeping children. Each child who spends the majority of their sleeping hours per night in night care must have an individual bed and mattress or another sleeping arrangement that provides adequate support to a child's body and of a size appropriate to the age of the child. The mattress must be fitted with a waterproof cover. Additionally, each child who does not spend the majority of their sleeping hours in night care must have an individual crib, portable crib, play yard, cot, or mat with bedding. Children under the age of 18 months must be provided with a crib, portable crib, or play yard for night care sleeping. The upper level of bunk beds must be used only for children 10 years or older when a bed rail and safety ladder are in place. Other than infants, children must be provided with sheets, pillowcases, pillows, and blankets. Sheets, pillowcases, and blankets must be laundered at least weekly when soiled and before use by another child. If providing night care, there are provisions for personal hygiene. Each child must have access to the following: an individual washcloth, towel, toothbrush, comb or brush, and sleepwear. The opportunity to brush their teeth with an individual toothbrush and toothpaste labeled with their name, and the opportunity to take a bath or shower if needed. If providing night care, dinner must be provided to children in night care if a child is at the child care center after their dinner time or has not had dinner before entering night care. A nutritious snack must be offered to all children after dinner service and before bed. Each child present at the time breakfast is scheduled must be served breakfast unless the parent specifies otherwise. Thank you for watching. This concludes the Certified Child Care Center video series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC, DELC.